Okay, there's an increased prevalence of kidney disease across the world, and basically because of increased prevalence of diabetes and hypertension. And the diabetes and hypertension also increasing its prevalence basically because of the change in the dietary habits and the social atmosphere in the world. And in our country, the diabetes is the leading cause of kidney failure, and type 2 diabetes especially, and it is increasing in its prevalence basically because of the increase in the episodes of the prevalence of obesity and hypertension also as well, and the change in the dietary habits are also contributing, maybe the more stress related hypertension. And if you really look at the etiology of kidney diseases in the world and also as well as in our country, it's a hypertension and diabetes, they predominant. And the diabetes is the most common cause of end-stage renal disease, followed by hypertension. There are certain genetic disorders also which contribute to the kidney diseases, of which the polycystic kidney disease is the most common. Polycystic kidney disease runs in the families which is autosomal dominant, and it is almost seen in one in every 200 to 300 people. There's a lot of research going on how to really curtail the problem of polycystic kidney disease. Other than that, certain glomerular diseases, certain tubulointerstitial disorders also will contribute to the kidney disease. And other than that, the drugs, some so-called painkillers and the antibiotic therapy, and the infections related to the kidney, as well as the stone disease which can kill the kidneys gradually over a period of time. All these diseases are contributing to the kidney failure, and of which diabetes and hypertension, they deserve a special mention about it. Diabetes is seen in one in every 4th to 5th person in the country, and it's increasing prevalence. And previously when we were students, we used to learn that the type 2 diabetes predominantly occurs after the age of 45 years. But now we are seeing the children, even children with the age of between the age of 16 to 18 with the diabetes, and the young adults are getting into diabetes. And if somebody gets a diabetes at the age of, say for example 24 to 28, and they are going to develop a kidney disease between the 35 to 40 years of age group. So with the next 3 to 5 years after the onset of diabetes, they are likely to get into some kind of a kidney diseases, and they lead an absolutely an unhealthy lifestyle afterwards, because once diabetes and the kidney disease sets in, they are going to have a lot of complications. The diabetes not only troubles the kidney, it also spoils the health in general, along with the development of diseases related to the eyes, the heart, the brain, and the nerves and the blood vessels everywhere. So diabetes affects each and every cell in the human body. And hypertension, though hypertension looks to be very simple, hypertension can be easily detected, can be easily diagnosed, it can be easily evaluated, and it can be easily treated also. And the world's probably the largest money market is there with the hypertensive drug therapy alone. And we have 9 groups of antihypertensive drugs, which are almost every drug is very good, and ultimately it is only to control of blood pressure which is more important. But despite that, it leads to the mortality or the death across the world of more than 50% of the mortality in the world every year is basically contributed by the high blood pressure. So high blood pressure contributes to the significant mortality, and of the victim of high blood pressure, one of the victims of high blood pressure is the kidney. So though it can be very easily controlled, only it can be easily monitored, but despite that, the people are not aware of high blood pressure. And unfortunately, high blood pressure has got no external manifestations, it has got no symptoms. So most of the times the diagnosis can be done very randomly when they go to the doctor for simple reasons like a cough, fever, etc. The moment they are diagnosed, the young people predominantly, they say that they are absolutely young and why they should go for further investigations, and they don't even think, they don't even accept that they have high blood pressure, because that is not seen externally by any means. So even if they accept it, they take several years to get started with the treatment. Even if they start the treatment, they really don't take it for a long time, they stop it in between. So that is the reason why the high blood pressure has become a major contributor to the mortality all over the world. So it is the same scenario either in India or in other countries also. Other countries also the same problem. Even the most developed countries also, high blood pressure treatment is inaccurate and inadequate and inappropriate in most of the cases. So these two are the major killers. So glomerular diseases are the ones which which affect the kidney for no reason. So predominantly that's all genetic, and especially it occurs in the children and the young adults, and as they grow in age, they get into some kidney failure. So chronic tubulointerstitial disorders are the ones which affect the kidney and lead to the kidney failure over a period of several years. But unfortunately, we cannot really know what is the reason behind the acute chronic interstitial disorders. It probably is the pollution, it probably is the drug which we have been taking for silly reasons, and it is probably the some genetic tendency, because this we could see the chronic interstitial nephritis also in predominantly in several groups of families. So that is one of the reasons. So chronic tubulointerstitial disorders and the chronic glomerular diseases are probably the genetically mediated inherited disorders in good number of the people. That's why we always say that the kidney disease is the disease of the family, and it runs in families, and it is genetically mediated, most of them. So these are the basic reasons, etiology for the kidney failure. So unfortunately, the kidney failure in the initial stages will not have any kind of external manifestations. It is absolutely asymptomatic. Most of the people, they get detected with the kidney disease accidentally through some basic screening methodologies or few investigations done for the other sake. So especially nowadays, when the software companies are giving the jobs only after the people undergoing some basic medical examination. So in that, many of the people are getting detected with some kind of a kidney diseases. Otherwise, they will be detected very accidentally. Kidney disease can be divided into 5 stages, 1, 2, 3, 4, 5. The first 3 or 4 stages, there will not be any major manifestations. Only in the stage 5, the people will have either swelling of the feet or the swelling of the face or the frequent micturition. They have to get up more frequently in the night to pass urine, and they will have a disturbed sleep, and they also will have other complications like lack of appetite and difficulty in breathing, especially for the simple exertion also, and they get into complications like other cardiac complications, other stroke, paralysis, etc. Then only they go to the doctor and they get detected with a high creatinine. So because the manifestations are not there, most of the people, they won't even understand that they have a kidney disease. By the time they realize the fact that they have a kidney disease underlying, it will be almost in the stage 5 or something like that, nearer to the dialysis requirement. Then the stage 5 also, many people will not be having any kind of a symptom. So when they come nearer to the dialysis requirement, they get into some manifestations of the kidney disease. There is difficulty in breathing, that is called shortness of breath, or lack of appetite, and a low grade kind of fever, and intense pruritus, itching, and difficulty in passing urine sometimes, and nocturia, that is passing more urine during the nights, etc. These are some of the non-specific manifestations of the kidney disease. Otherwise, the kidney disease manifestations are basically because of either because of the high blood pressure or because of the anemia, which is contributed by the kidney failure. So the kidney has got so many other activities to do. It's not just a filter, and it has got so many filters. The filters are called glomeruli. Each kidney has got around 10 to 15 glomeruli. Other than that, kidney has got a minute small tubules called nephron, of which the kidney, whatever the blood filtered becomes urine, and urine becomes truly a urine by the time it comes out the kidney while passing through the urinary tubules. And there is a space in between the tubules, that is called interstitium. This space also has got certain activity. This is the space where the vitamin D is synthesized. So you know that vitamin D comes to the sun rays, and when it falls onto the skin, it produces a special substance called dehydrocholesterol. So that becomes an active form of vitamin D after passing through the liver and into the kidney. The kidney is the major factory where the vitamin D is synthesized. Vitamin D is important element or substance for the bone strength. So when the vitamin D is not synthesized properly, these patients are with the kidney disease are going to get lot of complications. So other than the vitamin D, kidney also produces another hormone called erythropoietin. Erythropoietin is the hormone which is synthesized in the kidney. It is something like a vehicle that transports the iron into the red blood cells and increases the hemoglobin. So that is one way of that is the one reason why the anemia is predominantly seen in patients with the kidney disease. Other than that, the kidney also produces a hormone called renin, which acts on the blood vessels to increase the blood pressure. So whenever the kidney is diseased, the two hormones called vitamin D is also a kind of hormone. The vitamin D comes down, and the level of vitamin D comes down, so the bones become very weak, and the hemoglobin also comes down, basically because the erythropoietin hormone synthesis is not taking place, and the renin synthesis increases, and that affects the blood vessels, and hence there is increase in the blood pressure. So these are the manifestations of the kidney diseases. Other than that, the patients will not have any major manifestations. It is only the screening and the screening and the screening which is very, very important in kidney failure. Of course, the screening is important for any kind of a early detection of any kind of a disease. But unfortunately, in the kidney, you will not be able to understand that the kidney disease is present or not till the manifestations they come, and by the time the manifestations they start appearing, it is almost nearer to the end stage kidney failure.